Do you prefer working in the ICU or with the longitudinality of the pain patients, or with the quick little, I guess, bits that you get from regular anesthesia?
I think for me, my career path, it's not unusual compared to many other nurse anesthetists across the country have a very similar career path because it is required out of acute care experience before you can apply for anesthesia school. So, and the average nurse anesthetist, when they apply to school, has 3 to 5 years of experience in the ICU or in the emergency room or some acute care setting like that. They're all different. The ICU is a different type of experience. I personally, my wife worked in neonatal ICU for 30 years. I did pediatric ICU for 6 years, and it wasn't until I walked away from it to go into anesthesiology that I realized what a toll taking care of sick people and sick children in particular took. You don't realize until you step away from that sort of intensity the effect that it has on your mental health, your how you feel, until I walked away and then started to take care of healthy patients. So the first 5 years of my clinical practice in anesthesia was at LA County in UCLA. I was taking care of very sick patients. I did very complicated cases, anywhere from neural anesthesia, uh, orthopedics, liver transplantation. I took care of everybody in those settings. Trauma at USC, a lot of trauma there. And then in probably 1999, 2000, I went into the ambulatory care setting and I was doing outpatient anesthesia, which was pretty much healthy patients. Uh, and I've been doing that ever since. During the course of that, I was working with a pain management anesthesiologist who is boarded in pain medicine. I helped him in the pain management practice, and then also that became part of my practice. I like all of it. There's not one aspect that I like maybe more than the other. I will say I don't like taking call in the hospital that I used to, being up all night for 20 hours and taking care of, really, really sick patients. I don't miss that. And certainly that's something for the younger set, I
Mhm.
think, when you have that young energy and you can stay up for 24 hours and do that. I certainly don't want to do that at this age.
I think also that this the toll that it takes taking care of sick patients is greater on people who are younger or people who are older, or does it stay kind of consistent throughout someone's career?
I don't think that's necessarily any more difficult. I, I think that's the nature of it, no matter what you do. And the reality is, even in, you know, young, healthy patients or, you know, outpatients, anything can happen anytime, anywhere. And you always have to be ready. So I've always said, I've heard some people say, well, nurse anesthetists are okay for the easy cases or the uncomplicated ones. The anesthesiologist that I used to be partners with, he used to say, anybody who thinks that anesthesia can be either supervised or can be done from a distance hasn't practiced anesthesiology. The reality is anesthesiology changes minute by minute, second by second, literally. Patients can drop their heart rate uh, at any moment. They can, and the person who is in charge of fixing the problem is the one who's at the head of the table. There's nobody else in the room. So the person who is at the head of the table, whether it's an anesthesiologist, a nurse anesthetist, or a dental anesthesiologist, or an anesthesiology assistant, those are the four different types of providers in the United States who deliver anesthesiology care. Whoever it is that's at the head of the table is the one who has to fix the problem.
Thank you so much for listening. I hope you enjoyed. If you don't mind, please leave a like and subscribe. And with that being said, see you in the next one.